external otitis, otitis externa. So to start with, I will introduce a case study, that is a 9 months old baby with complaints of excessive cry with decreased feeding, pulling of the ear and ear discharge. So what do you think is the diagnosis? So to know about that, so let us enter into our main topic, that is external otitis. So to begin with this topic, I would like to brief out to you the basic anatomy of this ear, external ear. In an infant, the outer 2/3 of the ear canal is cartilaginous and the inner 1/3 is bony, whereas in an older child or adults, the outer 1/3 is cartilaginous and inner 2/3 is bony. So it's the reverse. So the bony part initially is very less, and as the age progresses, the bony part increases to 2/3. Now, the epithelium which is lining this ear canal is thinner in the bony parts than in the cartilaginous portion, and there is no subcutaneous tissue, and epithelium is tightly applied to this underlying periosteum. Hair follicles, sebaceous glands and apocrine glands are scarce or absent in this area. And the skin in the cartilaginous area, it has well developed dermis, subcutaneous tissue, hair follicles, sebaceous glands, apocrine glands. The highly viscid secretions of the sebaceous glands and the watery pigmented secretions of the apocrine glands in the outer portion of this canal combines with the exfoliated surface cells of the skin to form what is called cerumen, that is ear wax, which is very protective because it forms a water repellent coating in the canal. Okay. The normal flora of this external canal consists mainly of aerobic bacteria and includes coagulase negative staph, cornybacterium or diphtheroids, micrococcus, and occasionally staph aureus, viridans streptococcus and Pseudomonas aeruginosa. Now, excessive wetness because of swimming, bathing, increased environmental humidity, dryness, that is dryness because of dry canal skin and lack of cerumen, and the presence of other skin pathological conditions like previous infection, eczema or other forms of dermatitis, and trauma because of digital or foreign body induced or usage of cotton tip applications. All these things make the skin of the canal vulnerable to infection by the normal flora or exogenous bacteria. Now, external otitis is also called swimmer's ear, although it can occur without swimming. It is caused most commonly by Pseudomonas aeruginosa, but staph aureus, Enterobacterus aerugens, Proteus, Klebsiella, Streptococcus, coagulase negative staph, diphtheroids, fungi like Candida, Aspergillus, they all may be isolated. The most common by Pseudomonas aeruginosa.